Hello, everybody. I am Veena Khanke, Director of Grants and Partnerships at Dining for Women, and we are going to have a conversation with UNICEF USA. I have Amy with me here in the office who's going to make sure this is all technologically done appropriately. But hello, UNICEF. Why don't you go ahead and introduce yourselves?
Hi, Veena. Thank you so much. My name is Mansi Mehta. I'm the Assistant Director here at UNICEF USA. And on my right-hand side, or your left-hand side, is...
Hi, I'm Alicia Godsberg. I'm a Resource Mobilization Manager at UNICEF USA, and I work in health.
And hi, everyone. My name is Kelly Procida, and I'm a Senior Associate here at UNICEF USA.
So before UNICEF begins their presentation about the Rohingya project that Dining for Women is presently fundraising for, I just wanted to remind all our Dining for Women members that we have been in a partnership with UNICEF USA for about the past 2.5, 3 years. Mansi Mehta is the major contact that I am in contact with a lot of the time. And the two projects that we have fully funded is the Syrian refugee project in Jordan for $100,000 and the Gender-Based Violence Project in South Sudan. We are now presently fundraising for another $100,000 for the Rohingya refugee project in Bangladesh. So UNICEF, I'll turn it over to you.
Great. Thank you, Veena. So as we pull up our presentation over here, I just want to start, first of all, by saying thank you truly from the bottom of our hearts, from UNICEF USA, to all of Dining for Women members, board members, and staff for working so hard, for being so dedicated and passionate to creating and ensuring that change is being made to help women and girls around the world. It's always a pleasure speaking with Dining for Women members about the incredible support that you are having and making continuously on behalf of women and girls, and we are incredibly grateful for this continued partnership for a second year in a row for the Rohingya refugee crisis. So with that being said, I'll just quickly go over what our presentation will consist of. We'll focus on providing all of you with an overview of UNICEF. What and who is UNICEF? What is its reach and presence? And then we'll jump into who and what UNICEF USA is, primarily emphasizing the difference between UNICEF and UNICEF USA. From there, we'll talk a bit about the Rohingya refugee crisis. What is the situation on the ground for the Rohingya? Who are they? Where are they coming from? And why are they going into neighboring Bangladesh to seek refuge? And then from there, we'll tie into Dining for Women's support and the impact that your generous donation is having on the Rohingya refugee population. And then, of course, we'll have time at the end to address questions. So from there, I'll turn it over to Kelly to give you some more context on UNICEF and UNICEF USA.
Perfect. So as Mansi just said, excuse me, we're going to talk briefly about our global reach as well as our local presence. So UNICEF was founded in 1946 by the United Nations after World War II to help children whose lives and futures were at risk. For over 70 years, UNICEF does whatever it takes to put children first, having programs in 157 countries. These programs aim to protect children's rights, give them a childhood in which they're loved, protected, healthy, educated, and are able to fulfill their potential. UNICEF's #1 partner is the government, and they work to build their capacity to adopt good policies and deliver services for children and their families. UNICEF also partners with other UN agencies, private sector partners, civil society, families, and children themselves towards this attainment of the Sustainable Development Goals. UNICEF also relies completely on voluntary donations from public and private sector donors, including its 34 national committees, which leads me into UNICEF USA, which is one of the 34 national committees, or NATCOMs. So national committees, including UNICEF USA, advocate for children and raise funds in public awareness to help UNICEF reach the world's most vulnerable children and their families. NATCOMs play a vital role in UNICEF's response to emergencies by engaging the public through mainstream social media outreach, advocating to local representatives, and raising much needed funds in support of UNICEF's humanitarian action. UNICEF USA is the oldest and largest national committee, and we were established in 1947, just 1 year after UNICEF. And to quickly touch then on the breadth of UNICEF's work, UNICEF works in 7 programmatic areas, as you can see here, from health, water, sanitation, and hygiene, or WASH, nutrition, HIV and AIDS, education, child protection, and social inclusion. And then cross-cutting again on all of those 7 program areas is emergencies, gender equality, and climate and environment. So that just gives you a quick top line of UNICEF, UNICEF USA's work, and then how that all fits into the work that you all are doing, which I'm going to now pass it back to Mansi to talk about the Rohingya refugee crisis.
Great, thank you, Kelly. So with that, before we jump into what the situation on the ground is for the Rohingya refugee crisis, if we go on to the next slide, I'd like to give you some more context on who actually the Rohingya are. But before that, so since August 2017, more than 900,000 Rohingya, including nearly 500,000 children, have fled violence in Myanmar and settled into Cox's Bazar, Bangladesh. So if you actually look on this slide, you can see in pink, Dhaka is the capital of Bangladesh. And then right below that, you'll see a white portion which says Cox's Bazar. And then right next to that is Myanmar. And so the Rohingya refugees are fleeing Myanmar and crossing over either via boat or walking, often for weeks, to make their way into Cox's Bazar to seek refuge. And these children and these families and individuals, primarily women and children, are fleeing violence, and they have witnessed the horrors of this conflict. And many have seen torture, witnessed torture themselves, or have been victims of rape, extremely grave violations, which, as you'll hear a little bit later in the presentation, the Myanmar government is simply not acknowledging. So who are the Rohingya? The Rohingya is an ethnic Muslim minority consisting of approximately 1.1 million people in Myanmar. Around 90 to 95% live in the northern Rakhine state of Myanmar. And as I said, they have been and continue to be heavily discriminated against. They are denied citizenship. They are severely restricted in their freedom to movement. And as of last August 2017, there's been a brutal military crackdown of rape, murder, torture, and arson. And this has triggered one of the largest humanitarian crises in the world. An estimated 60% of the Rohingya who are displaced are, as I said earlier, children. And as you can see in this picture, the living situation for the refugees in Cox's Bazar isn't the greatest. They are living in these tarp-like bamboo huts made out of plastic. As I said, bamboo. It's on these really steep sort of hillslide areas, which is Cox's Bazar and all of Bangladesh, in fact, is really prone to heavy monsoon season, so mudslides, landslides, which within moments and seconds can really destroy their homes. So that itself is a big threat. And of course, as I'll get into in the next few slides, the living conditions are so congested and so tight, and that itself is alluding to kind of exposing the Rohingya population to outbreaks and diseases. The last thing that I want to mention on this slide here is that Muslims have lived in Myanmar really since as early as the 12th century. However, the Myanmar government does not recognize them as an indigenous group, which is causing them to flee and see these grave violations. So as a result of this situation, UNICEF has scaled up its humanitarian interventions and closely collaborated with partner NGOs, with, of course, the Bangladeshi government to respond effectively, more immediately to the needs of the Rohingya population. So the influx of refugees, as I said, is really creating this immense pressure on the population within the camps, but also the surrounding communities. Public health issues are arising. Of course, the sexual and reproductive health needs of the populations coming into Cox's Bazar needs to be addressed because of the potential rapes that have happened, just to make sure that new mothers or young girls are getting the care that they really truly need, along with psychosocial support. 60,000 women are estimated to be pregnant and require basic or comprehensive obstetric care. Among these women, only 22% have reported using health facilities or giving birth. There's a lack of knowledge and sociocultural acceptance of sexual and reproductive health, which further contributes to the problem. But most importantly, I would say, as we heard when we talked about gender-based violence in South Sudan, in a refugee setting, women and young girls primarily face social and safety barriers to accessing healthcare. So if they wish to leave their home at night, there's a lack of lighting, I would say, in the camp. So they don't feel as comfortable. There isn't much gender segregated latrines where they feel comfortable using that space in a dignified manner. So, all of these issues pose challenges which the Rohingya are facing on the daily. And of course, not surprisingly, poor access to healthcare then increases maternal and newborn morbidity and mortality rates. But I will say that with the support of the government and humanitarian partners, and of course partners like Dining for Women, refugees have gained access to basic services. Over 6,000 children identified as unaccompanied and separated are at risk for trafficking, early marriage, and sexual exploitation. But that really is why your support and partnership support from members like Dining for Women is so crucial, so that we can make sure that women and girls are getting the appropriate care that they need, even after being so traumatized and really witnessing such grave violations. So, with that being said, I just want to pause for a second to show you a video which provides an overview of what the refugee camp looks like.
This camp came together so quickly. It is amazing how well it's being run. Healthcare is being provided. Vaccinations are being provided. There is an elementary education system. There's psychosocial support. There are child-friendly centers throughout the camp. Every person that I spoke to in the past couple of days has told me how thankful they are to be here. They've said thank you to Bangladesh, thank you to people for actually caring. The rest of the world has to come to see these children as children. They're not refugees, they're not migrants, they are children. We're grown-ups and we need to find a solution.
Right, Alicia.
Okay, great. Thank you, Mansi. So I'm going to talk a little bit about what UNICEF is doing in the refugee camps, UNICEF in action. So in terms of maternal and newborn health, the period around birth is a critical window of opportunity to prevent and manage maternal and newborn health complications that can otherwise prove fatal. It's critical, therefore, to have available and accessible skilled birth attendants, as well as basic and comprehensive emergency obstetric care around the time of birth. Regular visits by community health workers before, during, and after delivering can be instrumental in preventing complications and postnatal mortality. UNICEF promotes a holistic, rights-based approach to maternal and child health that seeks to enhance the role of women. UNICEF supports the involvement of women, families, and communities in proactive care seeking for pregnancy, nutrition, birth preparedness, and having a skilled attendant at birth, the recognition of maternal and newborn danger signs, early initiation and exclusive breastfeeding, postnatal care, and support for optimal birth spacing. So how does UNICEF achieve this? Well, we have 4 key strategies, as you can see on the screen here. The first is life-saving service delivery in the refugee camps. So for example, UNICEF will train community health workers to immunize children and undertake mass routine immunization campaigns in the camps, preventing vaccine-preventable disease outbreaks. So like the woman we saw in the film who was going around to the huts and giving children vaccines. The second strategy is promoting social cohesion and competence building in the host communities. So as Mansi was saying, the the health system is already stressed in Bangladesh, and now we have 900,000 Rohingya refugees, really stressing the health system. So what UNICEF is doing for maternal and newborn health is now going to be benefiting the host communities as well. So one example of this is upgrading the newborn stabilization unit at the district hospital for sick newborns and providing adolescent-friendly healthcare services. The third strategy is system strengthening and accelerating program implementation across the entire district. So UNICEF identifies gaps in healthcare and challenges to providing services at the camps and helps strengthen the broader health system by scaling this up throughout Cox's Bazar district. And fourth, strengthening the government service delivery across the country through preparedness and response capacities based on lessons learned. So similar to scaling up to the district level from the camp level, UNICEF employs all their best practices and lessons learned to help strengthen the national healthcare system through taking these policies that are working and working with the government to implement them nationwide. So now we're going to talk about the impact of your support. Thank you again for your generous support and working with UNICEF and UNICEF USA. And you can see that your support is going to contribute to enhancing maternal and neonatal and child health interventions, benefiting approximately 275 pregnant women or new mothers and 1,500 children, including newborns. So UNICEF does this by strengthening referral systems. And that means conducting assessments to identify gaps in newborn care and health facilities in camp settings. So if there are a lot of newborns who are suffering from cholera, for example, and they need to be referred to a hospital with better care, like the specialized unit, that is one way that they can strengthen the system. The other is improved quality of care at primary healthcare facilities, building the capacity of the health workers and training community health workers and volunteers on maternal and newborn health, including at home-based care. And lastly, improving the guidance for all community healthcare workers so that these lessons learned and system strengthening capacities can be scaled up across the country.
Great, thank you, Alicia. So from here, I know we have some time for questions, but before we do that, or as we transfer over to Veena, I just want to say thank you so much, Dining for Women, Veena, to allowing us this opportunity, and thank you, Dining for Women members, for your continued support. And we at UNICEF USA and UNICEF really look forward to the continued conversations and partnership.
Mm-hmm. I wanted to remind all our members that we will be fundraising for this project for the rest of this year. And if they are interested in finding a one-page project fact sheet, it is on our website under partnerships, which is under the tab Learn. So for my UNICEF colleagues, I'm going to ask you, my first question is, here are 900,000 people who have come into this densely populated country. What are some stories of challenges in service delivery to such a large group of people?
I'll take that one. Well, first, thank you again. And I want to say, when we talk about the people, 900,000 people coming into Bangladesh, we're talking about people who are fleeing massive violence. So some people flee by boat if the tides are able to support them. Other people are walking with just the clothes on their backs for weeks at a time, as Mansi said. And they arrive, they're exhausted, they're malnourished. But one story in particular that I wanted to share, that was shared with me by one of the senior emergency officers that went to Bangladesh. He's a doctor. And when he first got there with his team, they went to the camp to check on the service delivery. And there's actually a vast area between Myanmar and the camp in Cox's Bazar they call the no man's land, where people who have arrived by boat or by foot, they're waiting to be processed. And you can imagine there's thousands of people waiting there. And they arrived and they were walking around, and they came upon a young woman who must have been about 16 years old, and she was in labor. So they ran back to their Jeep and they got blankets and jackets, and they went back to this young girl and they helped deliver her baby. And she was healthy and her baby was healthy. And yet the girl was sobbing, she was crying. And the doctor said, "Why are you crying? Everything is fine, you're fine, the baby is healthy." And she said, "My cousin gave birth yesterday on our way here, and she died, and I didn't want to die. And when he said that, we all in the room, we all shed a tear, and we realized just how difficult these circumstances are for these women, these young women, traveling. Maybe they've been a victim of rape, or maybe we don't know what happened to this girl to get her where she was, but we know that when she got there, UNICEF was there to help her. And it's thanks to supporters like you, so thank you.
Well, this seems like a huge humanitarian crisis. It seems unwieldy for us viewing it from this end. Can you explain to us how all the NGOs work together in order to bring some kind of coherence to all the nonprofits that are working in this area?
Yeah, sure. Well, there's actually, for emergencies on this type of scale, like the Rohingya crisis, there is an international coordinated response that the UN and international community organizes together for greater accountability to make sure people have their basic needs met. And the overarching management of refugee camps around the world, wherever they are, is the responsibility of the United Nations High Commissioner on Human Rights, UNHCR. And UNHCR sort of manages all the different agencies. So, for example, the World Food Program is in charge of making sure everybody has nutritious food. And UNICEF works for women and children in these situations across all areas. And that's the focus that UNICEF provides across all areas, whether they're the lead agency or they're just supporting.
Mm-hmm. So, bringing this closer to our project, the one that we are going to be funding, since we are focusing on women and children, and women in particular, and service delivery to them, I know 66% of the people of those coming in are women and girls. Can you address the somewhat delicate issue of some of these women and girls having been raped?
Sure, I can tackle this, and then Alicia, feel free to chime in. But yeah, as you heard in the presentation, sexual and reproductive health of the new arrivals requires urgent attention. And a UNICEF colleague of ours from Bangladesh stated that around 60 babies a day are taking their first breath in appalling conditions away from home to mothers who have survived, again, displacement, violence, trauma, and at times rape. So this is obviously far from the best start to life. So as new waves of violence started in Rakhine State, there was widespread reports of rape and sexual violence against women and girls. And again, due to the sensitivities and the stigma behind reporting and coming out about being raped, even in the camps themselves, that's part of what UNICEF does is the psychosocial support, is to be there to talk the women and girls through feeling comfortable with coming out about it, or having someone just there to listen to them. So women and children who are survivors of sexual violence are the most vulnerable, obviously. But our colleague said that because of the stigma behind it, it is impossible to know the true number of babies who have been or will be born as a result of sexual violence. But it's vital that each and every new and expectant mother and every newborn receives all the help and then has access to that psychosocial support, so that we as UNICEF can monitor and think about the repercussions beyond that.
Mm-hmm. So it has been dining for women's interest that we partner in our impact partnership grants, which has been with the Peace Corps and with UNICEF, with organizations that are always at the policy table. So can you give us some idea as we wrap up this conversation, the role that you play with governments and what's coming next for this population?
Sure. I'll tackle that as well. And Alicia, again, feel free to chime in. But as you heard Kelly mention in the beginning of the presentation, UNICEF's #1 partner everywhere is the government. UNICEF is there before, during, and after an emergency. And again, that whole holistic approach to addressing the needs of a child from the day of birth, before birth even, obviously, well into adolescence is very critical. So negotiations and conversations are always being had. We use the term suits and boots a lot, internally and also externally. We say suits because our staff on the ground is there at the forefront, at the table, talking to government officials, talking about policies that need to be implemented to then allow for the NGOs on the ground, to then allow for UNICEF and its other stakeholders to be able to do the work and access or provide care for the vulnerable. And one quick example of this is really child marriage. I mean, you can't really have programs against preventing child marriage unless we're able to convince the government to create a policy to ban child marriage. So, you know, and Myanmar is a whole different conversation, but with Bangladesh, as Alicia alluded to, Bangladesh is a third world country themselves, and they have a lot of their own problems and a lot of their own issues trying to support their own people. And so UNICEF is there at the forefront talking and negotiating. Referrals are being made to allow emergency care, emergency situations from the refugee camps into government-hosted hospitals. And so those conversations are continuously being had. UNICEF is having those conversations with military, with rebel groups, because our stance is always to put children first. And so even if that means talking to opposing parties, UNICEF will do that to meet the needs of women and children.
Absolutely. Well, as we wrap up, I wanted to thank all of you at UNICEF USA for all the conversations that we have had in the past 3 years. And I wanted to let our members know that our UNICEF colleagues are available to speak at multi-chapter events if regional leaders are looking for speakers. There are regional offices UNICEF USA has. Please get in touch with me or with Mansi, and we can help coordinate that for you. Meanwhile, UNICEF USA will continue to give us videos and photographs and updates of the Rohingya project so that all of you can keep track of this. Thank you for being part of this process, and it is our deep honor to be part of UNICEF USA's work for this population. Thank you so much.
Thank you,
Thank you.
Vina. And it's likewise, we feel the same way. It's an incredible honor and privilege to partner with Dining for Women and be a part of this bigger sustainable picture with you. So thank you so much. And we look forward to hearing from all of you.